All right, let's check out clip number 1.
Now, doctor, I want you to test me for everything. Every disease on this chart.
Okay, love it. First thing he says is, doctor, I want you to test me for everything. We get this so often in the emergency department and primary care doctor's office. Unfortunately, there's not enough time and resources to be able to do that for everybody. So typically, it is a primary problem focused visit in the emergency department as well as primary care doctor's office.
Fine. We'll just start by drawing some blood.
Oh my gosh. I don't think I've ever had someone poke through an arm all the way that bad, but that was hilarious. It just goes underneath the skin. The veins are just underneath the skin, like barely.
Come on, keep blowing.
Oh, nice. Trying to do something called a pulmonary function test to see how well you're breathing with a crazy old school apparatus. Ancient, but very cool.
Okay, 12 centimeters. Excellent.
The modern day test does not measure how far your face gets sucked into the hose. It has to do with the function of how much you can breathe out and in. Got some treadmill tests.
I am a big boy.
I like this medical office. I've never seen these type of stairs going up and down and circling around. Don't realize that the electrodes will probably get stuck and caught everywhere. Clear body jammed.
There's your problem.
I feel like patients have a fear when they go into like a CAT scan machine that they're going to go into this room and this tunnel of death. It's not. A CAT scan machine, just a cylindrical type of donut appearing with a hole in the middle, and it's only about yay wide. It's not very long. An MRI, totally different. That is a scary tube. But a normal test, no, it doesn't happen that way. That was funny. Let's check out clip number 2.
Now, what you see here is the radioactive dye we injected flowing through your husband's circulatory system.
All right, that's super cool. The radioactive dye, we never get to see it this way kind of in live function. It's very rarely. You can do bone scans where you get radioactive isotopes injected into your body and then you can see where there's injuries. PET scans do the same sort of thing where they're having these type of images, as well as even the HIDA scan for your gallbladder. So we have multiple different types of images in medicine that use radioactive markers that light up on a scan to see active cells going on. So here with the vascular system, it's actually pretty cool. You can see the couple chambers of the heart. You can see basically the main blood vessels and all the offshoots, so pretty awesome.
But doctor, I haven't injected the dye yet.
So they haven't even injected the dye yet. Of course Homer had some sort of abnormality going on.
Now, Homer, this is a new body fat analysis test. I start you jiggling and measure how long it takes to stop.
So a body fat analyzation does not occur by smacking someone's fat and seeing how long it takes before it stops jiggling. No. So at the doctor's office, you use calipers. Calipers pinch the skin at your tricep, your hip, and your buttocks. Then you average those numbers together and you get a percentage of body fat. Let's keep going. Oh my gosh, it's still rolling.
Yes.
Oh man.
Nurse, cancel my 1 o'clock.
Yeah, so no, the only time actually in medicine where we might push on an abdomen, we're checking for what's called a fluid wave. And that happens when somebody has acidic fluid or something called ascites in their abdomen. Typically this happens with liver failure. And we can see if there's actually fluid in the abdomen. You can actually tell if it's moving. Let's check out clip number 3.
Hi, everybody.
Surgical scene. Super cool. Before we even start, old school operation theater. This is super cool. They actually still have these in some hospitals. You can see them in old school movies. But I trained and did some rotations at Massachusetts General Hospital, and they still have their old school surgical operational theater. And it's actually called the Ether Dome. We have modern medicine now, but they actually used a type of ether basically to knock somebody out so they can operate on. Pretty crazy back then.
Let's not get the law involved.
So it's not for non-medical people. So he's got to get sterile, you got to scrub, you're in there for a couple minutes. Specific way everybody in medicine is trained to clean themselves to go into the operating room every single time. You need to be sterile for that patient to reduce risk of infection.
These gloves came free with my toilet brush.
The gloves should not be free from your toilet brush. You get surgical gloves that are sterilized, and you put them on in a very specific way when you're in the operating room. All right, and Homer just got knocked out by gas. So modern day medicine, now we inject you with a sedative, knock you out that way, and then we keep somebody sedated and tightly monitored. That way we can control how deep you're sleeping and then be able to take it off and you can wake right back up. All right, the doctor's sweating a crazy amount. You don't want that sweat dripping in there.
Doctor, what's wrong? Don't you know where to make the incision?
All right, Nick. Don't panic.
Oh, geez.
Think back to med school.
So med school is like college, right? There are people who party hard, but if you can party hard and still get everything done, perfect. But hopefully you're not in the middle of an operation and having to think back of how to actually do a procedure.
Seriously, baby, I can prescribe anything I want.
Oh, jeez.
I know I'm supposed to cut
my
something, but what?
Okay.
And where?
You don't want that kind of doctor not even knowing where he's supposed to cut or what he's supposed to cut. And then, to make everything worse, he pulls down his non-sterile face mask with his sterile glove. Now his right hand is not sterile anymore. He needs to re-sterilize that side. That's crazy. I don't want that doctor operating on me, any of my friends or family. Crazy. Let's check out clip number 4.
Hi, everybody!
Uh-oh, it's the same surgeon.
Now, there are many options available for
Dr. Nick.
underweight individuals like yourself. I recommend a slow, steady gorging process combined with acyl horizontology.
Of course.
You'll want to focus on the neglected food groups, such as the whipped group, the congealed group, and the chocotastic.
What can I do to speed the whole thing up, Doctor?
Be creative. Instead of making sandwiches with bread, use Pop-Tarts. Instead of chewing gum, chew bacon.
So Homer obviously is not underweight. He is way overweight. Probably has a BMI greater than 35, body mass index. But now he's got a food pyramid that's all sweets and candies and grease. Not so good. Do not make a sandwich with Pop-Tarts. I mean, it maybe sounds tasty, but I wouldn't do that. You really need to watch what we eat and keep our bodies as healthy as possible. And even now, the food pyramid is changing because we're discovering and finding out that there's a certain amount of foods that we need and not need actually in our diet.
You could brush your teeth with milkshakes.
Bart, great idea. Let's brush our teeth with milkshakes. I mean, if I could have a chocolate peanut butter milkshake every day, I'd be one happy dude. But I also want to live as long as possible, and that's definitely not one way to get there.
Hey, did you go to Hollywood Upstairs Medical College too? And remember, if you're not sure about something, rub it against a piece of paper. If the paper turns clear, it's your window.
Oh my gosh, that's horrible. Rubbing food on paper to get all the grease to show that it's that horrible for you. That's pretty funny, but that's horrible, okay? Don't do that. Fried chicken, bad idea. It's made with different oils that you shouldn't even be ingesting to begin with. Let's check out clip number 5.
Homer, I'm afraid you've torn out your anterior cruciate ligament.
Did you say anterior?
Yes.
Oh no! Anterior cruciate ligament, okay, ACL, everybody knows about this, right? There, you have one in each knee, and it basically connects the top part of your leg to the bottom part of your leg, the femur to your tibia. So if you tear it, sometimes you can have it surgically repaired by putting it back, or you actually might need a cadaveric or another animal's. There's all different ways that you can actually get a new ACL, but you really need it to have a good functioning active knee to be able to do all different movements.
Now, how did this happen?
Maybe a little morphine would refresh my memory.
Alright, morphine, yes. It feels good to some people because it doesn't actually affect the pain in a limb or an arm or skin. It actually affects the receptors in your brain to tell you not to care about the pain. So you have to be careful because morphine, as well as any other opiate, reduces your respiratory drive. And unfortunately, that's how people die. It reduces their respiratory drive so much that they literally just stop breathing on their own. So be careful.
I don't know. I'm still a little hazy.
Oh my gosh. This is horrible that this is on a cartoon.
Like it was yesterday.
Oh my gosh.
It happened today.
Hey man, you're harshing my buzz.
See, he's talking about being buzzed.
It all started when...
Oh my gosh. Playing basketball, nice.
You go, Homer.
Oh my gosh. All right, I love The Simpsons. This is hilarious. Obviously, he's not going to dunk on a planet. Very funny, and yes, morphine, Dilaudid, fentanyl, any of these IV drugs will take you to another planet. Basically, that's what The Simpsons are trying to tell you.
Well, Doc, I think I did pretty well on my tests. You may shake my hand if you like.
Well, under the circumstances, I'd rather not.
I like how the doctor kind of backs away. Usually you should maybe have some gloves on or something like that anyway. You don't want to ever make somebody feel weird by not shaking their hand, maybe a fist pump or an elbow or something, but you don't ever want to back away and just be like, I don't want to touch you. That's not cool.
Mr. Burns, I'm afraid you are the sickest man in the United States.
I love that it says, you are the sickest man in the United States. You never lead with the bad news. You always have to kind of get into it slowly and discuss what was found and then discuss what the next steps are. Oh my gosh.
You have everything.
You mean I have pneumonia?
Yes.
Juvenile diabetes?
Yes.
Hysterical pregnancy?
A little bit, yes. You also have several diseases that have just been discovered. In you.
New diseases.
You sure you just haven't made thousands of mistakes?
No, I'm afraid not.
Hey, 1,000 mistakes? It could happen. Lab tests sometimes are in error. The machines aren't calibrated. We always confirm whenever we have that abnormal of a lab because there could be lab error. So just something to think about.
Well, this sounds like bad news.
Well, you'd think so, but all of your diseases are in perfect balance. If you have a moment, I can explain.
Well,
here's the door to your body, you see? Here's what happens when they all try to get through the door at once.
I like the analogy of not everything can make it through.
We call it Three Stooges syndrome.
Three Stooges syndrome is not a thing.
I'm indestructible.
Oh, no. In fact, even a slight breeze could...
Mr. Burns is like, yeah, I am a perfect specimen. I'm indestructible. And the doctor's like, no. A little feather or a little piece of little breeze is going to knock you out of whack, and all of these things can get through that door. Okay.
Poison, tasty fish.
Oh my gosh. Be careful.
Concentrate.
Whoa.
Concentrate.
I want
So there are common poisonings in fish. The most common poisonings are cicuterotoxin and shigatoxin. But in the puffer fish, which is rare, there is another type of poison that is deadly. It is 1,200 times more deadly than cyanide. So if you actually get this, it basically is almost a death sentence and you die by asphyxiation.
Fan-fugu-tastic.
Uh-oh.
Oh
no! Oh no!
For God's sake, don't eat another bite! We have reason to believe you have eaten poison.
Poison?
Yep.
What should I do? What should I do? Tell me quick!
Oh, no need to panic. There's a map to the hospital on the back of the menu.
Alright, go.
You, Homer. What'll it hurt you, Homer? I never heard of a poisoned pork chop.
Never heard of a poisoned pork chop.
If, in fact, you've consumed the venom of the blowfish, and from what the chef has told me, it's quite probable, you have 24 hours to live.
Come on, no.
22. I'm sorry I kept you waiting so long.
There's no antidote for the toxin from the fugu, pufferfish, blowfish. What we'll end up doing is if there's respiratory compromise, we'll potentially put somebody on a ventilator, and we do something called gastric lavage. Basically, we're giving you medication to just flush the whole system. Get it out of the body to reduce how much toxin potentially is getting in your system.
Oh, Marge, I'm gonna die.
Oh no.
Well, if
that's sad.
It's that you'll feel no pain at all until sometime tomorrow evening when your heart suddenly explodes.
Typically, our hearts don't explode because our hearts are muscles, and the muscles typically don't explode.
Tell Dr. Nick.
Dr. Nick.
I'm at G. I got ants in my pants. I'm discombobulated. Give me a calmative.
A lot of times, if somebody is in this state, we'll try to give them medication to calm them down. A lot of the times after the medication, the patient will wake up and feel actually much better, and this event will have just passed. But this patient obviously is agitated for itching, he's confused, and just wants a pill basically to calm himself. It's kind of funny.
Slow down, sir. You're going to give yourself skin failure.
Skin failure, super underdiagnosed, and typically happens closer to the end of life. Simply, it's decreased blood flow to your skin or tissue, which then causes the breakdown. It's very disturbing, and it just kind of erodes through. It's very unsightly, and I hope people don't ever have to experience that.
Now, the symptoms you describe point to bonus eruptus. It's a terrible disorder.
Bonus eruptus.
Skeleton tries to leap out the mouth and escape the body.
Now, I'm an ER doctor. I have seen the skeleton come out of the body. In the sense, fractured bones that rip through the skin are now exposed out.
Our one chance is transdental electromicide. I'll need a golf cart.
Yeah, transdental electromicide. Oh geez. Oh my gosh. So electrodes to the head, actually. I don't know exactly where he put it. But there's something called ECT, electroshock therapy, that is used in the psychiatric world. People actually say when they're done their treatments that they actually feel a lot better and can potentially get off their medications or reduce their medication. And the only major side effect is amnesia, but then that typically goes away after a little bit of time as well.
They're doing it for themselves.
Hey, where's the door locked?
Oh no, it's Dad.
Oh no! Always injuries when they fall off the bed. Gotta be really careful.
What's going on?
Oh my gosh.
We're drunk. Really drunk.
Oh, thank God.
Oh my gosh. Uh-oh. Bart is in bad place. Oh my God. Okay, look at what the heck is going on in this scene. First of all, weird position. I don't even understand. I actually haven't seen a patient in this position before. And then also using the defibrillator pads on someone's buttocks just doesn't make sense.
Why are you doing that?
Now, I'm afraid your son has cracked his coccyx.
Oh. Okay, this happens. The coccyx bone is way on the bottom. Basically, it's like a rudimentary tail in humans. It hurts a lot. I know there are people out there watching this who have either bruised their tailbone or coccyx bone or fractured it. It is no joke. It hurts. You can't even sit down. You can't even lay down.
I'm sorry. How long will it take to recover?
You'll have to wear this fanny cast for quite some time.
Oh my gosh, okay, there's no such thing as a cast for your butt.
Do all these people have to watch me?
Yep.
Son, this is a teaching hospital, which is why I equipped the seat of your cast with a viewing window.
It's a teaching hospital, so there's always people around, nurses, medical students, residents, nursing students, pharmacy students. There's a lot of people in the hospital that need to learn so that way they can treat future patients. A viewing window for the cast actually weirdly makes sense, because how are you going to poop?
Mr. Simpson, I'm afraid you have a crayon lodged in your brain.
There's a crayon in my brain? How come no one ever noticed it before?
Oh, I can answer that. You see, whenever I pick up an x-ray, I always hold it like this. My thumb must have covered up the crayon every
Oh my
time.
gosh, come on. We don't typically nowadays use films that are printed of x-rays or on a screen, on a monitor. Even then, no, you always hold it kind of the corners to make sure that you're not missing anything. That's just a bad excuse. I don't like that.
Do you have any idea how this might have happened?
It might have happened when I was 6.
When it was 6, nice. Oh, there it goes, right up the nose. Oh my God. It's coming out his ear. Oh my gosh.
Woohoo!
Oh my gosh, both ears.
This could be responsible for your subnormal intelligence.
Hey, I came here to be drugged, electrocuted, and probed, not insulted.
So actually, the different parts of the brain having to do with intelligence, personality, it all depends. And I look more posterior. It all depends if it hits certain areas of the brain. And typically where he has it, it could be motor sensory versus is it like intellect. Typically, it's a different area.
We could remove the crayon for you. It could vastly increase your brain power. Or it could possibly kill you.
Yep, you never know. It's been in there for a long time and it's just sitting in there.
Let's do it.
Gonna increase my brain power if you remove the crayon from the brain. Again, doctors do not know 100%, so they're gotta give you risk factors, gotta say, hey, we can remove it, but there's a risk of dying, there's a risk of bleeding, there's a lot of complications, infections, a lot of different things like that. But I love The Simpsons. I wanna see more. If you wanna see more, hit that like button. Oh! Oh! Bart! Skateboard injury.
Hurt. Oh, for crying out loud!
Yeah, not wearing a helmet. All the different things on wheels, because we can slip, fall, hit our heads, and it's dangerous. You can crack your skull open. It's not worth it. There's so many cool helmets out there. Wear something cool, enjoy it, and be safe, okay?
Just give him a nickel and let's get going.
I think we should call an ambulance.
Oh, jeez, a hit and run. No.
Bad news!
Yeah.
Your son is a very sick boy.
That's horrible. A doctor should never walk into a room saying, bad news. That is not cool. You need to go in with what we call a good bedside manner. You walk in saying, hey, we've done all these studies and this is what we have found. And then if it's bad news, you follow it up with, this is what we're going to do and this is the next step.
Just look at the x-rays. You see that dark spot there? Whiplash.
Whiplash? Oh no!
What?
And this smudge here that looks like my fingerprint? No, that's trauma!
You can't see the findings that he's suggesting on an x-ray. When you're doing an image where somebody has whiplash injuries, you're looking for fractures of the cervical spine.
Am I gonna die?
Yes, son!
Homer!
With all due respect, Mrs. Simpson, you're not a doctor. The boy's not a doctor. I'm not a doctor. The only person in this room who even comes close is this man.
Stop! You're embarrassing me.
Doctor, are you sure there isn't a little soft tissue trauma in the facial area?
Oh, yeah, tons of it. Just say when.
Oh my gosh. I get to experience and see a lot of people that come in from minor car accidents, minor injuries, and you get into situations where people want to sue another individual for an accident. But we're there just to treat the patient, not the situation potentially that brought you to our facilities.
You have an absolutely unique genetic condition known as Homer Simpson syndrome.
Homer Simpson syndrome? What is this? This is great. I gotta see what this is.
Brain is cushioned by a layer of fluid 1/8 of an inch thicker than normal. It's almost as if you're wearing a football helmet inside your own head. Why, I could wallop you all day with this surgical 2x4 without ever knocking you down.
It happens as we get older, the brain tissue actually shrinks. Isn't that crazy? The other question ends up being, is that on purpose that we were created that way? Because as we potentially get older, we increase our risks of falling with head trauma, which then increases our risk of bleeding in our head. So the fact that you now have more space inside your skull to bleed without it compressing onto your brain itself is actually beneficial. Uh-oh. Whoa! It's like a razor blade.
Bart.
Oh no. Oh no.
Oh, my stomach. You just don't want to take that test.
Sharp objects like that can lacerate the esophagus, perforate your stomach, perforate your bowels or your intestines. Go to the hospital, get an x-ray, and see if it's somewhere where a gastroenterologist could actually go down with his camera or his scope to be able to get it out of there.
Don't worry, son. You'll be fine. This boy's appendix is inflamed and about to burst, which will make it easier to find.
Okay, that doesn't make any sense. Appendicitis, your inflamed appendix, is inflammation of your appendix in your right lower quadrant. The appendix is probably about the size of your pinky. It's an infection. So an infection usually takes a little bit of time to occur. It doesn't typically occur after you ingest a sharp object.
Once I get in there.
And he's in like an auditorium so everybody can watch.
Hot dog!
Oh my gosh. Imagine you could get food at like be a sporting event.
I will count to 3 and you will be sound asleep. 1, 2, 3.
Actually, what we do when people go into the operating room of the OR and they get sedated, usually they actually given an injection of medication, something that in the family of a benzodiazepine, which actually helps with amnesia, so you don't actually remember the event. And sometimes another type of inductive agent of a sedative to just get you to go to sleep.
Scalpel.
Ah!
Oh no, he's awake.
If I fiddle with these knobs.
Oh my gosh, oh my gosh.
Pleasant gas.
Yeah, there's a gas leak.
Night gas.
There are some people that actually have reactions to either sedatives or paralytics to where they don't work, where you actually end up being sedated and paralyzed, but the sedation doesn't work. You're basically paralyzed, you can't move, but you hear and potentially feel everything. That's messed up.
Change me back to the blissful boob I was.
I'm sorry, we don't play God here.
That's ridiculous. You do nothing but play God.
The majority of physicians and doctors out there don't believe that. They are in the job to help others as best they can. They're human beings as well. But there are always the few in any industry that think they are potentially better than others.
Look, what if we gave you the name of an unlicensed surgeon?
Oh, that would be heaven. Mo Sislak?
That's right. I'm a surgeon.
Mo. I love it. I love it. What?
Want here, appendectomy, lipo, or
what?
The sampler. That's very popular.
I want you
the sampler
crayon into my brain.
No problem.
What?
The old Crayola oblongata.
Crayon in the brain.
All right.
Oh.
What?
Deeper, you pusillanimous Pilsner pusher.
No, it doesn't work that way. The anatomy doesn't work that way. The only time you can get an object in your nose straight into your brain is if you have a fracture through the cribriform plate, basically, or a basilar skull fracture to get through up. It doesn't connect that way. The nose anatomy goes backwards. It doesn't go up.
All right, all right.
Oh!
Defense!
Whoa!
That's pretty dumb, but,
Extended warranty? How can I lose?
This is horrible. Brutal, but I guess the crayon's gonna break no matter what. It's an innate object. Actually, the wrapper's probably gonna cause more infection than anything else.
Now, with my new HMO, I can provide every medical service you'll ever need under one roof. Let's go visit the optometrist.
Wait a minute, wait a minute. This ophthalmologist is using an otoscope with the light shining the wrong direction. So if you look, as we continue to go, in his hand, you can see the ear tip pointing in his direction.
Your son has a temporary condition called lazy eye, where one eye is weaker than the other. You'll have to wear these for 2 weeks. Menachem Begin wore a pair just like them.
Lazy eyes are a thing, and people have it. Sometimes it's muscular, neurologic, and typically it can improve. Sometimes you might need to have surgery to tighten up a muscle. Sometimes you can even see people with like a lazy eyelid as well.
That scalp's a little dry. You better see our dermatologist.
Rub a palm full of this medicated salve into your scalp every half an hour. Keep him away from open...
Dry scalp, most likely it's just either related to water or sometimes a fungus. There are shampoos that you can use.
These should help those fallen arches. Enjoy.
Interesting clogs on his feet. Typically you only need like orthotics on the inside. You don't need to have these big built up weird shoes. Sometimes if somebody has a leg length discrepancy, you can get specific shoes that might have a little bit higher sole on the outside.
Throat looks a little red. I better spray it.
Whoa.
Oh, thanks, nice lady. My voice is crazy with this brain already. Oh, I feel so much better, Mr. Medical Science type person.
Oh my gosh, so I'm hoping that was an ear, nose, and throat doctor, or the fancy word is an otolaryngologist, or an ENT doc. But there's not that many sprays that we spray in the back of the throat. There are some that we use, there's a fancy name for it, but it's just called hurricane spray for numbing. You gotta really be careful with that. That can cause a slew of other medical problems. It's something called methemoglobinemia, which is a whole other crazy medical term and issue. It's pretty rare, but if you spray it too much, it messes with like blood cells. I've seen a bunch of Simpsons, but just not these specific ones. And these are old school. I love like the old, not as good cartoon graphics, but the content is really good. So I love these. And my only sign-off note is make sure if you're doing any like sport where you're gonna hit your head potentially on a hard object, wear a helmet. There's so many cool options. There's so many brands out there. I can throw a link in the description below of like different helmets that you should check out. I personally wear a Smith when I go snowboarding. But there's so many different options out there.
Guess I don't have a choice.
Lisa, what are you doing? Oh, we're going to Dr. Nick.
Complete confidentiality? Oh, and I'm sure he's as good as Dr. Hibbert. That's so right in his ad.
And he speaks Spanish. Patients sometimes don't want to tell us stuff because they're worried that somebody's going to find out.
Yo, I must have like fallen on a bullet.
This is classic. So I work at a trauma center. We see stab wounds and people will give us the most BS stories you could hear. And we're just like, yeah, sure, okay. We know exactly what happened. And then we usually typically get the story from an officer that shows up because every bullet wound, knife wound needs to be notified to the police. I love that the intake form has all those options. It's a very sketchy place.
Excuse me, Mr. Smithers. Bart may be seriously hurt. Could we possibly go ahead of you?
No. I really would rather get this taken care of.
Oh, man.
Wheelbarrow lines over there. Loneliness and cheeseburgers are a dangerous mix.
Oh, give me a cheeseburger. First come, first serve is definitely not how the emergency department works. I don't know about Dr. Nick's office. Patients get so pissed off when they're not immediately seen. If somebody goes in before them, even though they showed up after them, or if they get discharged while they're still waiting. Holy cow. You have to understand, an emergency department is that. It's an emergency. So if you are waiting, you are not dying. The person that's being rushed in has a medical emergency that is life-threatening, so they need to be seen immediately. Whoa, why does Bart look so big?
It's gotten a vice.
Oh, my little...
Maybe it's got a bowel obstruction or something?
Having a heart attack.
Shouldn't have a heart attack at his age. Oh, and then he just collapsed.
Come on, son. You can fight this.
Check.
Do the Birdman.
Check his pulse. Check if he's breathing. Oh, okay, he's okay.
Why don't you dance? Dance!
Oh my gosh. It never helps in a situation when somebody's screaming like that. One, the patient's not feeling well. If somebody's freaking out, the patient might think they're even worse, and then the body responds in a negative way.
Kids aren't supposed to have heart attacks. They're supposed to skin their knees and poke their eyes out and be smothered by
So did he have a heart
cats.
attack?
Well, Bart had a heart attack, and it's his own damn fault.
Whoa, so kids can have heart attacks, yes, but it's typically a congenital issue, but kids shouldn't have heart attacks. Now, Bart looks a little big, so I don't know if he's eating bad, his cholesterol is high, developed plaques within his coronary arteries, and the plaque ruptured, causing an occlusion of one of the blood vessels, which then leads to a heart attack.
These dark spots in his pulmonary arteries are molted milk balls.
I'll believe the milk balls for 1 second. The coronary arteries are actually the little vein-looking things on the picture of the heart that we have right now.
His liver looks healthy.
Mm-hmm. That's a wad of Laffy Taffy.
You can see foreign bodies on x-rays though, sometimes. It depends on what the foreign body is made of. If you swallow a paperclip, you swallow a nail, you swallow a penny, a quarter, a dime. We can see those on x-rays. It all just depends.
Now, when Bart goes home, he's going to have to follow a program of strict diet and exercise. Damn it, I will not bury another patient.
Oh my gosh. Are you serious? Bart needs to get his diet in check and some exercise. Diet is the most important when it has to do with cardiovascular disease, when it also has to do with weight loss, when it has to do with cholesterol, all of these things.
But I might explode. I'm not going to let anything happen.
Feels like it's going to explode. Somebody could explode, yes. You have a AAA, right? So an abdominal aortic aneurysm. What happens is that blood vessel expands, and then it could rupture due to the weakening of the wall, and then you have a ruptured AAA.
This man's kidneys have exploded. There's nothing left.
Oh, no.
That doesn't happen. What ends up happening is sometimes you can have traumatic injury to the kidney where you have blood around it, or you can have like decreased blood flow and you can have a ischemia or infarct to the kidney, or long-term chronic issues. The kidneys actually start to shrink and go away, but they just don't explode.
That's what happens when you get older. It's one of those natural things. Beautiful.
No, it's not.
Actually, his kidneys were fine.
Yeah, there you go. So you got a picture of the kidneys the way that it should be, and then the one without.
Excuse me, doctor. I think I know a little something about medicine.
Homer, with all due respect, this x-ray reveals a textbook kidney blowout.
Kidney blowout. Maybe from trauma, but typically not from a normal kidney the day before.
Which would explain those loud pops you heard.
I don't feel so good.
Oh, yeah, it doesn't feel good.
Oh, I'm afraid your eating days are over.
That's not funny. That's not funny. Why would you do that to a patient? So you can eat, but you just need to be able to filter out your blood to get toxins out, nutrients in and out. That's what our kidneys do.
Come on, Doc. There's got to be something I can do to help my dad.
Well, you could give him a kidney.
A kidney?
Yep. If you're compatible, you could do a kidney transplant. You can live your life with just one kidney. There's some caveats to some of these things.
Okay, fine.
The gift of life, right?
Come through for me.
Now, Homer, this may...
Oh my gosh. Put the mask up, get some gloves on, use some alcohol to wipe off that vial so it's clean. Like, come on, Simpsons.
But...
Oh, he's out. He's running away because of the needle? Oh, Homer, watch out. Oh, no. Oh,
Boy,
oh man, that's messed up and funny.
Waking up.
Oh,
what
I'm
happened?
so glad you're all right.
Common that people get in these situations where they get scared of what's going to happen because it's a great idea, and then all of a sudden in that situation, like, holy crap, I don't want to do this, and run away. But ultimately, remember, you're giving the gift of life to somebody. If you don't, they're going to be stuck on dialysis the rest of their life, which they can survive.
Oh, great. Dad's dead.
Dad is dead. No, he's not dead. He's uncomfortable, though.
Have you been eating that sandwich again?
Stomach, something on the stomach.
Which?
What did he eat? Company picked.
Dead to that 10-foot hoagie.
Oh my gosh, there it is.
For a week. I think the mayonnaise is starting to turn.
He's been eating it for a week. That's hilarious. At least he's taking his time, but I think it's probably going to start to go bad and spoil.
I found this behind the radiator.
Oh man, it's purple.
Suggestion noted.
Look at those shrooms growing off of it.
For a moment.
Are you going to eat it?
That's so gross.
Yes.
That's so gross. So the question is it really bad for you? Not necessarily. Cheese molds and things like that. Sometimes that was like penicillin back in the day. Probably will cause some GI discomfort, right? Because it's not something that your system sees normally, and it's probably going to cause abdominal discomfort, diarrhea. You might have some inflammation. You may need some antibiotics. But let's see what happens to Homer here.
Oh.
You look terrible.
I don't care. So
oh, look at his color, his skin.
Lips are turning blue.
Yeah, no, it's not good. So when somebody's lips are turning blue, that's due to decreased oxygenation. Usually when somebody's turning pale, green, they're sick. He definitely needs to see a medical professional and see if he's got an infection. Get blood counts, see if his kidneys are failing, see if his liver's failing, see how high his white blood cell count is just for monitoring. But please don't eat food that is spoiled.
It's shot day!
Oh, that's...
Welcome to hell.
Ah, nobody likes shot day. Kids are healthy, they go to the doctor to get their shot. So every time they see a doctor, they equate doctor with shot and they fear the person in the white coat, right? I feel bad. Like I try my best to be like happy, trying to make kids laugh. It is kind of just a fact of life.
Mann Avenue Medical Plaza.
Oh my gosh, look at the fear. Look at the doctor.
Fool, you live in a country where childhood diseases have been practically...
I love it. I love it. It's hilarious.
That hobo skeleton is not
It's hilarious.
a toy.
This is ridiculous. Only babies and ex-junkies are...
There you go, Lisa.
Stick me, Chucko.
Do it. Oh! Okay, it's over.
I have a lollipop.
Yeah, perfect.
Well, that just leaves Bart.
Don't forget Maggie.
Oh, I got her when your heads were turned. Got her good.
Potentially want to distract them, but do it super fast. Usually the pain happens actually when the needle's out if you do it well enough.
Come on, one more long one and we can get this thing done.
Oh my gosh, that's so messed up. Come on, Doc.
Congratulations, it's a boy.
Okay, first off, kids don't come flying out like that. But it also depends on if this is your first delivery versus like your 5th delivery. Could it go quickly? Yes. But do children typically come sliding out super fast? Not really.
What? Another boy? Plus Bart?
Well, this is unorthodox, but what would you think about taking a cute baby girl instead?
What? Oh, is that Maggie?
Died in childbirth. The father is listed as 10,000 lunatics, but none of them has shown up yet.
A parent dying during childbirth is rare, but it does happen. You can actually have an amniotic fluid embolism, which then causes cardiovascular collapse, and then you could die that way. You could bleed out. The uterus potentially can rupture. A couple different scenarios, but again, they're rare because typically somebody who is delivering a baby is typically young and healthy.
No!
I should warn you, however, we ran a standard newborn screen on her, and she tested positive for evil.
Evil? What the, he's already got Bart. Oh!
Better than a boy.
What? That was crazy. I've never seen that before. It doesn't normally work that way. There's adoptions, you know, different agencies if you want somebody else's kid, and they have to give up the kid to then be able to adopt. The first 3 days, I believe, there's actually a safe haven, bring to a hospital, police department, a fire department, no questions asked. Oh, he's a pallbearer. Whoa!
Oh, my back!
What?
And not in a good way.
Well, time to move on with our lives.
Oh, Bart's gonna put him under. Oh my gosh, that's messed up. Falling on dirt, it actually gives, so it should have some cushion. But he does look like he's a little jacked up.
Homer, you have a mild back sprain.
He sprained his back. Sprain and strain are pretty much the same terms. You sprain your ankle, right? So you've actually injured some ligament. You strained your back, you might have pulled some muscles and injured some tendons. They all kind of overlap with each other. But do you guys know that the most common reason why people miss work in the United States? Back pain.
And you also ingested a dangerous quantity of grave dirt.
Well, you're always telling me I should eat more dirt.
Not dirt, vegetables.
I love it. You want to eat more vegetables, which could be like roots and things like that, not dirt itself. But I will say, as we were all kids and we played around in dirt and licked our fingers and we're getting our immune systems up and running. It's actually not the worst thing in the world, but eating handfuls of dirt, no.
Ugh. Look, I just need to make sure your vertebrae are properly aligned. This should take only a minute and cost about $1,000.
First off, you wanted to make sure the vertebrae were aligned correctly. So he's got him strapped down to the bed. I don't know, he must be getting ready to take a picture, like an x-ray.
No! No!
Fascinating. When Homer is on his back, his stomach lodges perfectly under his diaphragm.
The image that he has here is not an x-ray. An x-ray is not going to show up organs like this. You'll see black areas where the lungs are and like whiter areas where the vertebrae and the heart are. And that's just because to do with density of tissue and air, that sort of thing.
Giving him a powerful singing voice.
Is that a real thing?
It is.
That's not a
Grandpa
real
Kelly
thing.
recorded an entire song on his back.
You know, Homer, your singing
Come
can
on.
alleviate patient suffering and save us a fortune at Demerol.
My pleasure. If ever I would leave you.
It shouldn't be related. Your voice is related up in your larynx, your vocal cord. So then the question is it changing position in your stomach changes the sound of your voice? Probably unlikely. Not something I deal with on a daily basis. The only time we ever hear people's voices abnormal is swelling up in the upper airway. Say they had a surgery which hurt their recurrent laryngeal nerve. Then you have different sounds of the voice.
I told you, a mosquito came out of my Laffy meal and bit me.
What's wrong with him, Doctor?
Mosquitoes are known for harboring disease. West Nile virus, even malaria if you go to other countries. Most of these are viruses and they produce like a viral syndrome, malaise, fatigue, weakness, but it's not something you can easily check in a lab.
It can't be mange. I just had him dipped.
Mange is like something that happens in animals and wild dogs. It's almost like mites that irritate the skin. Now in humans, we get scabies. Scabies are these little insects that burrow in your skin.
Your son is exhibiting classic symptoms of panda virus.
Panda virus?
Here, take a look.
No, my God, looks like a panda gummy bear stuck on his arm. So many things can bite you. Most of the time it's your own reaction or you develop like an infection because it inoculates you with the bacteria that's on your skin.
For a week, Bart will be highly infectious to others.
So he's highly contagious. So we have different diseases like measles, it's airborne. Then you have, say, syphilis. Syphilis is a sexually transmitted disease, but it's done by contact. Different disease processes are spread differently.
You'll be living in this bubble. It's clear plastic, so the world can see how normal you are.
What a messed up dog. Yeah, we don't have bubbles like that. When somebody needs to be in a bubble, so to speak, or not bubble, but quarantined, you just quarantine in your own dwelling. You don't need to be in a bubble. What is Homer running? Oh, knocked out. Oh my gosh. If your teeth get knocked out and you can bring them with you, please do that. Don't wash them off. Just put it in milk, water, throw them back in your own mouth. To reattach a tooth, you actually need those ligaments intact. This injury that Homer is now having, he probably fractured his jaw.
Homer, you've suffered a broken jaw.
Oh man, that is a messed up device. So we don't do those kind of devices. It's almost like getting a set of braces. Weird fact, you have to keep pliers on you in case you vomit or you have any airway issues. You can pop those open real quick.
He won't be able to talk for quite some time. I've wired his jaw shut.
You can actually talk when you have this device in. It just makes it a little bit harder because you're not able to accentuate what you're trying to say, but you'll be able to speak without any difficulties.
It's all explained in this pamphlet.
So your life is ruined.
No, we don't do pamphlets like that.
Dear, You can't eat solid foods.
Yep.
Those are his favorites.
He's freaking out because he can't eat. Well, obviously you can just use a blender and blend your food and you'll lose some weight. Just gotta make sure you get the right nutrients.
The only risk I'm taking is running out of marshmallows.
Oh!
Somebody get a doctor!
Clock falls off the wall, nails the leg. So the question is, do you have a tibia or fibular fracture, or is it just a contusion?
I want my wife to get
Whoa.
the best treatment money can buy. Whoa, whoa, whoa. Don't go nuts. Better than that.
That's hilarious. If it's an emergency, you can't just request the place that you want to go. You have to go to the first medically accessible hospital in this specific emergency. Unless, say, you're having a heart attack or a stroke, you need to go to a place that has basically a cardiac center or a stroke center where they actually have the right doctors and equipment and treatment for you in those situations.
Well, as you can see, it's a compound fracture.
Oh, I hate this word. The fracture is something called comminuted. Comminuted meaning it's broken up into multiple pieces. Now, she's in a full cast. If you put a hard cast, which is either made up of either plaster or Paris, these materials are hard as a rock. So if you continue to swell underneath, say in a day or two, you're gonna be in so much pain. In the emergency department, when you actually get a fracture, we put you in a splint to allow the swelling and we'll wrap it. And then this way, in a week or two, when you go follow up with the orthopedic surgeon, you'll have a cast put on at that point.
The leg must remain motionless, otherwise a hunk of bone could zoom right to her brain.
No, this doctor, come on, dude. A bone piece is not gonna go to your brain. It's just gonna stay in the tissue right there.
The main thing is for you to get better.
And don't worry, all the laundry and dirty dishes will be there when you get back.
Oh,
No, they
so
won't.
thanks, Bart.
We'll all pitch it on the housework, right, guys? Guys?
Get that.
So no, the IV fluid bags do not come pressurized like that. To pressurize and have it squirt out like that, you actually need to have a pump on the bag. We have machines that will actually help suck the fluid through and push it through.
Good Lord, you're wasting thousands of dollars worth of interferon.
And you're interferon with our good time.
Nice, Homer. I love it. Interferon is basically a type of medication you can use to treat viruses. Marge wouldn't need interferon. She would just need fluids and pain medicine and maybe an antibiotic if there's an open fracture.
Well, I'll be. That cured my canker sores.
If it gets shot in the mouth and is there for like a split second, you spit it out, you're probably fine. It's almost like, right, like Listerine, right? You have it in your mouth, you spit it out, you don't want to swallow it, but if you accidentally swallow it, you'll probably be okay. Same thing, you'll probably be fine, but who's swallowing interferon that's not under medical care for a specific reason?
You need an operation? What's the matter?
It's all the same, it's embarrassing, and I'd rather not discuss it publicly. What could it be?
It's like the game Operation. You guys ever play that game? Your family members may be around when discussing like medical situations, but the patient actually might not want the family to know unless they have a medical power of attorney.
I need professional help. Not to worry. This is the United States. We have the third best healthcare system in North America.
The third best healthcare in North America? Wait a second. Geography lesson. United States, Canada, and Mexico. Okay, I don't think that does really well for us.
Hi, Medicare. Hi, everybody.
Hi, everybody.
I speak with the doctor alone.
Of course. Oh, wait, I'm the doctor.
Did Homer just take a huge handful of cotton balls? Or there's a diet where sometimes people eat cotton balls. It's kind of a disorder because it's filling you up, but has no nutrients whatsoever. But actually can cause bowel obstruction, so please be careful. Do not do that.
What's taking Grandpa so long in there?
It's crazy that medical costs are so high here. In Denmark, to pick a country at random, healthcare is free.
Free? Honey, nothing is free but Splendors.
I do see comments that say, hey, I don't have health insurance, I'm not going to the hospital. Please, if you do have an emergency, get to the hospital. Your life isn't worth risking it because you're concerned that you might not be able to cover it. Trust me, they have programs to help.
It's a monster! Kill it!
Who is this?
Kill it!
It's not a monster. It's Mr. Burns.
Oh, it's Mr. Burns. Kill it!
All I hear is that accent and all I can think about is William Wallace and Braveheart. Anybody see that movie? I know it's old, but I like it. It's good.
Every Friday evening after work, Mr. Burns undergoes a series of medical treatments designed to cheat death for another week. First, Mr. Burns' chiropractors perform a slight spinal adjustment.
chiropractors don't do that intense of motions. I know a lot of people out there have opinions about chiropractors one way or the other, but they're very good with their hands. They are able to identify things that an image or a blood test can't necessarily do. Oh!
Then a team of doctors administers eye drops.
So the eye drops that they're showing are actually dilating your eyes, but you can also be getting drops for glaucoma, a lot of other ailments of the eyes.
Painkillers.
Painkillers aren't going to make you live longer. Painkillers are going to cover up pain that you have. You have painkillers in your system, you're not going to feel or care what's going on, and when the medicine wears off, it's actually going to be worse. So you have to think about that.
Don't worry, you won't feel a thing till I jam this down your throat.
Yeah, no. Sometimes singers can get polyps or nodes on their vocal cords and they need those cut off. It's a procedure, but you don't use that gnarly medieval device.
The most rewarding part was when he gave me my money.
You would not leave the office that way. Offices would require you to have a safe ride home, somebody to watch you and give you explicit instructions of what to do in these situations. Not just let somebody go into the woods.
But what's with the glowing?
I'll field that question. A lifetime of working in a nuclear power plant has given me a healthy green glow.
I don't think a healthy green glow occurs ever. The only thing we typically will ever see glow, potentially, is somebody who's overdosed or drank like coolant. So what happens is we can actually check your urine and put black light to it and kind of see that.
Mom, you'll miss the eclipse. There'll be another one in North Yemen in 2027.
So there's something called solar retinopathy. It occurs when you're actually looking up at the sun during these eclipses. This could actually cause retinal burning and actually destroys the cells of your retina. So you need to be really careful. Make sure you're wearing eye protection.
It's beautiful.
Oh, boom! There it is. Didn't even know that was coming.
Now, Marge, your eyes must stay completely covered for 2 full weeks.
Don't worry, honey. I'll be your seeing eye Homer.
I wouldn't trust Homer, no thank you. Somebody will come in where they actually bandage their eyes shut. Every time they open and close their eyes, it causes significant pain. Keeping the eyes closed, it allows the eye to heal instead of open and close.
Now, Simpsons, I must warn you, any stress could increase the blood pressure in Marge's eyeballs, leading to what we call Tex-Avery syndrome.
Tex-Avery syndrome. We actually have tools in the emergency department to check the pressures of the eyes. The simplest thing we have is something called a tonal pen. If you're having unilateral vision loss or significant eye pain, you definitely need to see an eye doctor. The only time I've ever seen like explosion of the eye is actually when there's a penetrating trauma to the eye itself and then the liquid is just flowing out of the eye. Potentially you're going to permanently lose your eyesight even though they can put fluid back in.
You gotta make me shorter, Doc.
Gotta make you shorter?
What do you mean?
I mean, take out bones, guts, whatever you gotta do to make me a micro-mo.
A micro-mo. So that doesn't occur unless you find somebody off-label, out of the hospital kind of thing.
No licensed physician would perform that operation.
Now close your eyes.
Nice, Dr. Nick.
When you wake up, you will be a woman.
No. I want to be shorter for a woman.
Oh my gosh. There has been many documented wrong side surgeries, taking out the wrong organ. Things do happen. So make sure if you have surgery, you very much clarify with your surgeon what is actually happening to you that day.
Maya is gonna love the new me.
Mo, why did you do this?
I ain't done nothing yet. But I'm considering it.
Well, there you go. Don't you wish you can go to the doctor's office and they have like sweet programs to see like what you would look like if you had this implant or that done to your body?
Because I want to share your world forever.
Mo, if you have to be like me to love me, then you're not seeing the real me.
There it is.
Cut me down to size, Doc. And can you wrap up the bones so my dog can have fun with them?
People will adjust the different features of their body for somebody else. Obviously, if you want to do it for yourself and enhance things about your personality, have at it, go for it. But if you're doing it for somebody else, make sure that you're doing it for the right reasons.
Homer, sitting that close to the TV can't be good for you.
Talking while the TV's on can't be good for you.
Sitting close to the TV, I always got yelled at when I was a kid. My parents were like, don't sit so close to the TV, concerning about eye strain.
Okay, let's get started. wake up.
Boy, sorry.
Now read the first line.
I ate pee-pee.
Typically, that's an optometrist's office that you're getting your eyes checked out. At Homer's age, there's something called presbyopia. You can only see at certain distances very well. And that's why people get like readers and stuff as you get a little bit older.
Maybe you're a candidate for laser eye surgery.
Will you get me out of having to choose classes?
Well, yes, but I must warn you it's an experimental procedure and we still don't know the long-term effect.
Less yapping, more zapping.
So we do like LASIK eye surgery. They actually do use certain types of lasers to help with retina in the back and different treatments. But when it comes to adjusting your vision, that's typically just simple blades, so to speak, and different tools.
Marge, what's happening?
Nice.
Oh, Homer, you got chicken pox. What the hell?
I don't know. Oh.
Chicken pox are so itchy.
It's very itchy.
If you see on Homer, they did a good job. They're different sizes. A lot of kids nowadays don't get it, but when I was a kid, everybody got it. Homer getting it as an adult is kind of weird. It's not uncommon. If you get it older, there's more complications related to it.
You sit in this oatmeal.
Oh, nice. Good oatmeal tricks. A lot of times you'd use oatmeal if you got a lot of poison ivy on you as well. Even lotions nowadays, they use different types of oats in it to soothe the skin, decrease inflammation, more comfortable, and doesn't itch as much. I hope he makes it. Oh my gosh. Holy cow. Would he have survived that? If he's falling down the face of a cliff, but it's not flat, you potentially actually have a chance. Don't do these kind of jumps. Please be careful out there. At least wear a helmet. One of his legs looks totally jacked up. Definitely going the wrong direction. It could be tibia fracture, tibial-fibular fracture, mid-shaft that's displaced, or it could be a bad dislocation at the knee. It's hard to tell, but those are things you think about. And then he's got this big knot on his head, which is a hematoma. Oh, and then add insult to injury, his board hits him right in the head. We see a lot of people who come in with head injuries without helmets on. Somebody's hitting the head with something, they're riding a bicycle, they fall. A lot of times, like motorcycle accidents, they are wearing a helmet and the helmets are destroyed, but luckily the person's head is fine. Yeah, he's getting airlifted out of there. In a basket, they're gonna hit him. Oh my gosh. Typically, you try not to use the longboard that much anymore, but it's probably a lot easier for transport. Potentially, put somebody in a seat collar, at least to stabilize the spine. There we go. Wow, that is a lawsuit ready to happen. He already had an IV with some sort of fluids running, looked like maybe some blood. Ambulances in the United States don't have blood because blood's always on shortage, so you don't want it to be in the pre-hospital setting. Oh my gosh. A little bit of TBI, a little traumatic brain injury. In sports, if you're high level and you're getting multiple concussions, there's a concern that you can get chronic inflammation, encephalopathy. So if somebody gets hit in the head, traumatic, and then passes out, definitely needs to get checked out.
I'm afraid he may never walk again.
What?
Row, row, row your boat gently down the stream.
Homie!
I mean, at least he's having a good time in his wheelchair. My mother is an occupational therapist. When she was going through school, they required her to be in a wheelchair for a few days just to see what the experience was. It's very interesting. Oh, that's the worst. Sometimes patients will try to leave and go to the cafeteria to get food or go outside the building and smoke. That's really not allowed. We offer nicotine gum or nicotine patches for anybody who's smoking. Obviously, they get fed at the hospital if they're allowed to eat. Oh!
Just breathe, sweet chocolate.
I mean, if you're crushed by a vending machine, have you ever tried to like move one of those things? It's super heavy. You're gonna cause some damage or at least not be able to get that off of you. How embarrassing.
Poor Homer. This world was never meant for one as beautiful as you. Ah! Kill it! Kill it!
Please, he's in a coma.
Non-medicated induced comas. It's hard to know exactly what the cause is, and sometimes people just wake up. As long as somebody is breathing on their own and they're not on a ventilator for life support, it doesn't become an ethical medical issue. It does if somebody's on life support and breathing through their neck.
Coma? Why, I go in and out of comas all the...
I love it. Maybe he has narcolepsy, basically where you just have a sudden onset of sleep.
This man is costing my health plan $5,000 a day. I demand that he
Oh my
die
gosh.
with dignity.
Obviously, I have nothing to do with billing and insurance, and only hear about it through like the grapevine. Different insurances cover different things, so it's not the same for everybody. It's a whole can of worms and really hard topic to talk about and try to figure out. They've been trying to do this forever.
Hi, everybody.
Hi, Dr. Nick.
Why is he using a reflex hammer on his abdomen?
Oh, dear. I see no signs of life. Just to be safe, we better pull the plug. Yoink.
A lot of people fake being unconscious. So unfortunately, we do painful stimuli. Sternal rubs, putting a pen or pushing on the nail bed is very painful. We don't want to cause any permanent damage, but we need to know if you're okay.
Don't worry, people. We have enough vaccines for 1 child per family.
Holy cow. This is like hitting close to home. Typically, a new vaccination, you got to use in adults first. Sometimes you can do it outside the emergency department, but very rarely because it can clog up the system. 1 per family doesn't make any sense.
Yes, I'd like 37 snifters of your influenza syrup.
Give him what he wants. He's the only taxpayer in this town.
People tried to pull that card. No, it doesn't work. Like, basically, everybody gets treated the same.
Sir, perhaps we should get out of here before people start resenting you.
Different vaccines had to be room temperature versus cold versus reconstituted because it was freeze-dried. So there's a lot of different things that go into it. So you just don't give people vials or shots.
Hurry, everyone. Roll in the shards. Come on, like this.
Oh my God. No, don't, holy cow.
Very sleepy.
What the heck? Sharing needles. That's how HIV can be spread. That's how hepatitis can be spread. Bloodborne pathogens. Don't partake in things like this. It wouldn't work that way anyway.
I want the brownie. I'm gonna get one. From the
Good
left.
chop his finger off.
Get the right.
Watch this.
For the reach around. Oh, he's too.
Even the noise. Nice. Oh man. If this does happen, hold pressure right to the end. Find the lost digit, wrap it in the wet paper towel, then maybe put it in a bag of ice.
We need more ice. My thumb is fading fast.
Don't put it directly in the ice bucket like that because it's going to cause a burn to the finger and could actually injure the thumb more.
Quick, Mo, Marge, cut off my thumb.
No problem. Just stick the old eye gouger in the pickle brine. That'll keep your thumb fresh and delicious.
What?
Thanks, Mo.
I've never heard of this. Now, if you lose a tooth, you can put it in milk, put it in your mouth, Hank's balanced salt solution.
I'm sorry, Homer. Your HMO doesn't cover this type of injury.
But I have finger insurance.
A thumb is not a finger.
Isn't there anything you can do?
What? Come on, what a bunch of garbage.
Symmetry, eh?
We don't care about that. You put the finger back on, figure out the expenses. Sometimes if you don't have the piece of your thumb, they'll actually take donor digit from somewhere else. They might take a toe, they might take another finger to put it as a thumb because the thumb is so important.
This lie has made Bart a new man, and it's giving me anxiety attacks. Relax. Ooh, so anxious. Ah! What's this?
Hives.
You've got bumpies.
Lisa is having a panic attack. She definitely suffers from anxiety as well. So anxiety is just being anxious, nervous, kind of a little bit on edge versus panic attack is when that anxiety just goes through the roof.
Sometimes tension hives are the result of inner stress.
Another word for hives is urticaria. Swelling, itch. Sometimes we'll have it as an allergic reaction. But stress can actually bring it on.
I'm going to prescribe some Sleepy and Dopey's children's chewable Xanax.
Xanax, these medications are very short acting, fast on, fast off. There are other ways to go about dealing with anxiety. Talking to a counselor, a therapist, a psychologist.
I don't want my daughter on meds.
Nice.
You seem upset, Marge. Talk to your doctor about Troxidone.
You are my doctor.
Well. Fancy that. This is going to turn your life into an oasis of peaceful zombitude.
Oh my God, Troxidone. It's not even a medication that I've heard of to prescribe. We have Trazodone, which is like basically another sedative type medication.
Side effects may include bleeding out your ears, Portuguese insolence, wandering eyebrow, intense longing for death, and seeing yourself as others see you.
Every medication that we prescribe has a side effect and has a negative aspect. But the question ends up being, are you taking the medication for the benefits that totally outweigh all the potential negatives? Oh my gosh, stomach stapling, meaning having its stomach shrunken so it's super small and taking the piece off so it's stapling most of the other part closed. And basically all that is doing is decreasing the amount of food that you can intake.
Okay, we put the band around your stomach so that no solid food may enter. You see? Just like so.
You can do what's called a lap band, laparoscopic procedure, and they put a band around a certain part of your stomach where they can actually fill it up with water and actually access it through a port that's just under your skin.
If you wish, we can perform the procedure in the office today.
And I know how I can knock myself out. Oh, look at your bill.
Typically, if you're going to have surgery such as this, you're going to be intubated, and they probably don't want you to have any food in your stomach for at least 6 to 8 hours so you can reduce the risk of aspiration. You don't want to inhale possible vomit from the food that's still in your stomach.
I guess considering all the training you received, this is quite reasonable. I've never seen anything so reasonable. It's the bargain of a lifetime. And
I think that was being facetious, but a plastic surgeon does go to college. You go to medical school, and then they go to residency for a very long time. They're charging based on if somebody has insurance or if they don't have insurance. I bet they have different actual billing costs.
Kids, your daddy underwent a special procedure so he can be more attractive to your mother.
You had your hot dog plumped?
No, I had my stomach stapled.
I was not expecting that. I'm assuming they're talking about his penis when relating to the hot dog and had it plump. There's really not any procedures that really make your penis any bigger. Oh my gosh. Oh. Just after having the procedure, the band is really tight, and they may have it to where you actually have to blend or puree. You can't have any solid foods for a short period of time.
Do you like guys who are attractive?
Homie, you look good.
All for you, baby.
So if you lose weight too quickly, your skin does not have enough time to shrink as well, because the skin has different type of elastic fibers within them. Sometimes people will require to have skin removal surgeries because there's so much extra skin.
Doctor, I'm embarrassed to show my body to my wife, and it's all because of your surgery.
You want me to unstaple your stomach?
That is a staple remover. It's huge and really funny, but no, they don't really use staples.
No, I want you to give me every other surgery you have so I can look good. And can you call it an aortic valve replacement so my insurance will cover it?
No problem.
Ah, there you go. Your aortic valve pumps out the blood, so a lot of times people need that replaced because it gets really stiff and you're not able to get the blood to go out, and then you can actually get backflow of blood. That's typically covered under insurance versus cosmetic surgeries are typically not, hence that's why they're trying to get it covered. They are inducing him, meaning starting the anesthesia by gas. Typically it's actually done with an injection of medications, and then you're actually kept asleep with the anesthetic gas. And that way it's easy to come right off and control a little bit easier.
I bestow upon Marge Simpson this $100 gift card, 2 sweatpants, etc. Did someone order a super stud?
Look at him.
My implants feel itchy.
Oh,
yes,
that's
I was
not
out
good.
of silicone rubber, so I used rolled up socks.
What? Rolled up socks? Yep, that's a lawsuit waiting to happen. I've seen some bad videos of people injecting different things into their muscles, which is really bad.
Smithers? What's the meaning of this slacking off?
There's a bee in my eye, sir.
You don't want to be stung by your eye because then it might swell up, puncture into the globe, increase risk of infection, risk losing the eye. Like, holy cow.
I'm allergic to bee stings.
Oh, and he's allergic to bees. If you have allergies to things that potentially are life-threatening, have an EpiPen on.
Perhaps you could paddle for just a little while, sir?
Quite impossible. I can try to bat him off if you like.
Really, that's okay.
He smacks him in the face, but the bee got pissed off and stung him, and now he instantaneously becomes limp. It can happen quick, but not that quick. Could be over in just a couple minutes. Get there.
Hospital. You have.
Which one? Oh, man.
Help.
Oh, Dr.
Holy
Nick.
smokes! You need booze!
They thought he was intoxicated. We get so many people that are dropped off at the hospital, and we literally have to start from zero, trying to figure out what's going on. So airway, breathing, circulation, then, you know, checking to see what the blood sugar is, checking potential alcohol level. Oh my, what is this green stuff?
What's wrong with us?
Oh, I don't like the looks of this.
You don't? Because that's what I said. Tell her, Bart.
The only time I ever see green on a human is related to something called Pseudomonas. The Pseudomonas infection is a type of bacteria that on the bandages you'll actually see like bluish green.
We better check with a doctor.
Yeah.
Welcome to Virtual Doctor.
A lot of times nowadays it's really hard to get into the doctor's office, but you can at least like talk to the doctor and get advice.
Enter symptoms now.
Let's see. Crusty sores?
Yes.
Horrible wailing?
Yes. Yes.
Any exposure to unsanitary conditions?
Duh, we're pigs.
Okay, and diagnose.
You've got leprosy.
Leprosy!
Oh my gosh, I've never seen leprosy, and typically it's more of a chronic infection.
Why, you little burn, body burn!
Holy cow! When we have somebody who comes to the hospital who has any type of burn to basically your face, we always look for these like singed hairs, soot in your nose, soot in your posterior pharynx, so the back of your throat, because then that gives us an indication that it actually went into your airway, increased risk of swelling, increased risk of basically losing your airway.
Tongue will be in that cast for a few weeks. It may put something of a cramp in your lovemaking.
I don't think I've ever wrapped somebody's tongue in bandages like that. It's really hard to keep on. The moisture still stays around. It doesn't stick.
No, it won't. If he wants me to do something, he'll just write it down.
Oh my gosh, that sound, the sound of the cast cutting saw. It looks scary, it looks crazy. You think it goes in a circle, really vibrates in like a very specific way.
Got it.
Oh! Was aggressive and ripped it off, but you can actually see on the cast that there was a cut on the top and a cut on the bottom.
Well, at least I can eat again. Cherry.
So I would definitely not, after having a massive injury to your tongue or the oral pharynx, jump right into eating something, even just sugar.
The fire burned off your old taste buds, exposing new ones.
It's almost like peels that we do to our face, right? When people get chemical peels to the face to remove like a layer of the tissue on top, kind of the same idea here when it's relating to injury to the tissue of the tongue, that then it wasn't a deep enough burn to cause permanent damage, but deep enough to where now it required new cells to regrow. Is that a Geiger counter? What is that? Is that for like radiation?
Can't lift arm or speak at normal rate.
Well, I'm afraid you have a case of acute radiation poisoning, Mr. Socha.
When somebody says they can't move one side of their body or they behave in such a way, the first thing we always think about is a stroke, obviously. Now, radiation exposure, very rarely do we ever see types of radiation exposure, but it can wreak havoc on your body.
Be able to play softball tomorrow?
It's never good when you actually have a really bad medical experience or diagnosis and the doctor is laughing, especially if you're not laughing and it's a not laughable moment.
No, by tomorrow you'll barely be able to breathe.
Oh my gosh. So if that's actually the case, in certain circumstances, we would actually intubate early to prevent you from stopping breathing and work on figuring out how this radiation poisoning is affecting your body. It could definitely be deadly. You can have symptoms within a few hours. It's ruining your DNA. It's breaking it down.
Ken Griffey Jr. needs to see you immediately.
The other thing that they don't really address here is this person had radiation exposure. That individual needs to be decontaminated, so then everybody around the patient does not subsequently get further radiation exposure.
We think it's an overdose of nerve tonic.
Good Lord.
Whoa.
Gigantism.
So gigantism is what I know it as acromegaly, and it typically occurs more in the pediatric adolescent population, and it has to do with pituitary abnormality and pituitary tumor, where growth hormone is basically made secreted.
Stupid crows! Shoo! Shoo! Shoo!
Whoa, bird attack.
That is not a worm!
Poor Homer, oh my gosh. Okay, you gotta worry about different birds could potentially harbor different types of microorganisms, pathogens that you have to worry about that can cause infections.
Ow! I hate getting stitches in my eyes. Stupid crows.
Don't be mad at the crows, Homer. They weren't trying to blind you. They were just trying to drink your sweet, sweet eye juices.
Sweet, sweet eye juices, aka aqueous, vitreous, the fluids of the eye. Isn't this doctor just a normal, regular doctor? I would not touch anybody's eyeball when it comes to sewing it back together. You want an eye surgeon, like a specialist related to the eye. The eye is so complex, so no, we wouldn't even mess with that. Even if the eyelid is lacerated, there's so many complications that could occur that you want a specialist to take a look at it.
Well, there is a medication, although it's a little controversial.
Does it go in the butt?
I'm talking about medicinal marijuana. Prescription pot. Texas THC.
Look, man, I don't do drugs.
The taboo conversation of THC. I work in California, so it's a little bit more open to talk about. There's actually medication that has actually been made for people who have certain types of epilepsy relating to THC and CBD.
But isn't marijuana or dope illegal?
Only for those who enjoy it.
Dope, marijuana, we actually just pretty much call it cannabis. Cannabis is still a Schedule I substance on a federal level in the US. But every country is different, and even states are different. Oh my gosh.
Okay, let's see. Toke as needed. Caution, objects may appear more edible than they actually are.
Cannabis, it increases the possibility of having what we call the munchies or wanting to eat food. And that is actually why one of the major reasons they use it in medicine is it helps with nausea as well as stimulation of eating food for people, specifically like cancer patients, because of the medications that they're given. Oh! Oh! No! Whoa, 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 whoa. It's like a horrible nightmare. You worry about just a swing. The swing you can get caught on. A lot of times more there's like fracture dislocations are the most common. And then you're thinking trampoline. Trampoline injuries are mostly like ankle fractures, dislocations. We see those all the times, especially with all these trampoline parks that are out there. But it's horrible that we're seeing like a river of blood coming out the other end. We're not seeing any tissue, thank goodness. Oh, I spoke too soon. There's tissue coming out like slices of a ham where there's the bone in the middle. Oh my gosh.
1, 2, 3. 1, 2, 3. Oh.
There's different types of CPR depending on your skill level and where you are. But the first go-to is hands-only CPR. But if it's just the heart, it's not going to work. But I will tell you, I've done CPR many times where the heart is exposed because we've cracked open the chest and literally somebody's heart is in my hands and we're actually doing CPR.
It's no use.
Oh, okay, Homer, that was kind of nice. So we actually do close the eyes, not just when somebody actually dies. If I'm doing, say, an intubation or any type of procedure and I'm sedating an individual, we'll actually do our best to close your eyes. And even in the operating room, they may put a piece of tape on your eyes to keep them closed. It really serves a couple purposes: keeping your eyes from getting dry, which can cause issues, and then making sure that they're shut so you don't actually get a cut to your eye.